just for the record, my shirt is pink today. It doesn't look like it, but in the spirit of the day, I'm there for that.
Excellent.
There's lots of shades of pink, Rudy.
And the shirts weren't pink this year. They were white with pink. Okay, there we go. Seems we have everybody in. So welcome everyone. So I'd like to call the February 22nd, 2021 regular council meeting to order and begin by acknowledging that the land on which we gather is the traditional unceded territory of the Katzie-Kwantlen, Musqueam, and Semiahmoo First Nations. And for any members of the public who may be in attendance to watch these proceedings, welcome. And just a reminder to keep your mics and your camera turned off while you are in attendance, please. So I'll do introductions. I'm Mayor Val Vandenbroek, and this afternoon we have all council here today. Councillor Paul Albrecht, Councillor Terry James, Councillor Gail Martin, Councillor Nathan Bahal, Councillor Rudy Stortaboom, and Councillor Rosemary Wallace. And for staff, we have Francis Chung, our Chief Administrative Officer, Darren Lane, our Director of Corporate Services, Carl Johansson, our Director of Development Services, Rick Baumhoff, our Director of Engineering, Parks and Environment, Kim Hilton, our Director of Recreation, Culture and Community Services, Kelly Kenny, our Corporate Officer, and Scott Kennedy, our Acting Fire Chief today. Before we go on to adoption of the agenda, so Pink Shirt Day is Wednesday, February 24th, and wear your support for anti-bullying initiatives. And I believe all of us are wearing our shirts tonight. Yeah, we were just having this discussion where they didn't actually have pink shirts this year, but the theme is lift each other up. So with 1 in 5 students being affected by bullying, chances are that you or someone you know is being impacted. So this Pink Shirt Day, our focus is working together and treating others with dignity and respect. And the COVID-19 pandemic has affected us all, and it has shown the importance of helping one another and advocating for those who need help. Help us lift each other up and support programs that encourage healthy self-esteem and teach empathy, compassion, and kindness. Bullying is a form of aggression where there is a power imbalance. The person doing the bullying has the power over the person being victimized. In addition to any physical trauma incurred, bullying can result in serious emotional problems, including anxiety, low self-esteem, and depression. There's various types of bullying: physical bullying, hitting someone; verbal bullying, using words to verbally attack someone. Example of that would be name calling. Social relational bullying, trying to hurt someone through excluding them, spreading rumors or ignoring them. Example, gossiping. And cyberbullying, which is right now, unfortunately, on the rise, using electronic media to threaten, embarrass, intimidate, or exclude someone, or to damage their reputation. And that also includes sending threatening text messages. So we just want everybody to know you're not alone and to ask for help and talk to someone you trust and try to find a healthy way to change what is happening and how you react to it. Call a helpline. Reaching out to a counselor in an anonymous way can help. Talking about it can make it easier as well. So there's a kids help phone to call, 1-800-668-6868, or you can go to the website at kidshelpphone.ca. And for adults, contact the Red Cross or BC 211 if you need help, because unfortunately, bullying just doesn't happen in schools and playgrounds. And remember, kindness and compassion can go a long way, so lift each other up. Thank you. So on with the adoption of the February 22nd, 2021 regular agenda. Are there any additions or changes to the agenda? Seeing none, that the February 22nd, 2021 agenda be adopted as circulated. Need a mover and a seconder, Councillor James. Councillor Stortenboom, all those in favor? And that carries. Regular meeting minutes from February 8th, 2021, that the minutes of the regular meeting held on February 8th, 2021 be adopted as circulated. Any corrections to that? Need a mover and a seconder, please. Councillor Stortenboom, Councillor Wallace, all those in favor? Any opposed? Okay. Public hearing minutes from February 8th, 2021, that the minutes of the public hearing held on February 8th, 2021 be adopted as circulated. Mover and a seconder. Councillor Stortenboom. Councillor Wallace, any corrections? All those in favor? Any opposed? Carries. Special pre-closed meeting minutes from February 16th, 2021, that the minutes of the special pre-closed meeting minutes from February 16th, 2021 be adopted as circulated. Mover and a seconder, please. Stortenboom and Wallace, any corrections? Call the vote. All those in favor? Any opposed? And that carries. So in our community spotlight today, we have our health contact services proposal and overdose prevention services. So Mr. Dan Kipper, who is the operations director, regional overdose response and vulnerable population and public health, Fraser Health. Is that right?
That's correct. Yeah, that's part of my responsibility, Mira.
Wow, that's a big responsibility. I will put it over to you, Mr. Kipper.
Well, thanks so much, and thanks for the invitation for Fraser Health to come today and present some of our planning going forward in regards to the health contact services and overdose prevention services. We have a number of members from Fraser Health here to provide the presentation, and starting off will be Dr. Fernando Mejia. He's our medical health officer, and he has responsibility in Fraser Health for vulnerable populations and some of the work that we're engaged in right now. And Jezza Mohammed she's our project leader on the overdose prevention planning, and she'll discuss the health contact services and the development of the overdose prevention sites. And then Erin Gibson, who is our manager in population public health and still does harm reduction work in Fraser Health. She'll be talking about some of the myths and misconceptions around overdose prevention sites. And then I'll finish up with talking about our planning for request for proposal and looking at potential service providers to provide this service. We have a short presentation through PowerPoint, about 10 or 15 minutes, and then at the end we'll open it up for questions that anybody may have. So maybe I'll turn it over to Dr. Mejia then to start off the presentation. You may be on mute, Dr. Mejia.
I'm sorry about that.
Yeah.
Thank you so much, dear Major and members of the council, for allowing us to have this presentation. Like Dan said, my name is Dr. Fernando Mejia, and I'm the acting medical health officer, one of the medical health officers at Fraser Health, and the overdose portfolio, and also the vulnerable populations portfolio is under my jurisdiction, so that's why I'm here. Can I have the next slide, please? So what I want to show you is basically some of the stats that we have related to overdose. And as you can see in this particular slide, we have overdose deaths in BC. This is in general. And as you can see, we have on the x-axis, we have years from 1994 until 2020. And on the y-axis, we have two components. On the left side, we have total deaths. On the right side, we have death rate per 100,000 people. So basically what you can see is that there was an important spike that started back in 2015. And of course, the situation got worse till the point that we had to call for a public health, for a provincial public health order to declare an emergency. The situation brought a lot of different resources and programs. One of them is the one we are discussing today. And as you can see, we were able to provide some relief to that particular emergency situation. And it was in 2019 that we actually saw a good result of those efforts. So as you can see, in 2019, we have basically a little bit more than 1,500 deaths, whereas in 2019, we had less than 1,000. In that case was 984. So unfortunately, the spike went up again, even higher than we would have in previous year, and that was in 2020. And of course, one of these situations was related with the COVID pandemic. So we can say that situations like interruption of some of the services and a change in the type of street drugs that would be available for people who use drugs would be another explanation for this. So basically, we are here recognizing that we've lost a lot of people, and those are, in some of those cases, preventable deaths. Next slide, please. So we move from BC General to what we've seen in Fraser Health. And as you can see, this slide shows the x-axis, the years from 2010 to 2020. And on the y-axis is basically the number of illicit drugs related deaths. So as you can see, again, it's similar to what I showed you in the previous slide. It was an important spike starting in 2016 with an important improvement of those numbers in 2019. And then again, an important spike that went higher to the previous records in 2020 with a total of 568 deaths related to overdose in 2020. All those slides that I'm showing have the source of information, the BC Coroner Office. So I wanted to share this with you to give you a perspective of how this change is evolving. And as you can see, it's been up in basically all BC. But if we want to focus on your region, Langley, what we can see is that basically from 2019 to compared with 2020, there was a percentage of 77% increase in deaths related to overdose. So this is important to keep in mind, as some of these deaths, like I said, are preventable. And my intention with this presentation is basically to discuss this idea and do more for those who really need it. Next slide, please. As you can see, this slide is just showing the concentration of fentanyl that is related to some of those deaths. And what this slide is showing is that if we have a sense of the type of concentration of fentanyl that was related to overdose deaths between January 2019 and May 2020, we were talking about a 6%. And if we compare that with a period of time between April and November 2020, what we see basically is that that concentration of fentanyl has doubled. Next slide, please. So it is very important to understand that there's something we could do. There's something that we need to implement to reduce this type of deaths. And this slide is basically showing where those deaths are occurring. So we basically have two different sites where we are collecting data. One is overdose related deaths inside, and that inside presents private residents or other residents. That part of other residents would include things like motels, any other accommodation that people might have. So it is important to realize that, yes, one important part of these deaths is happening inside. So as you can see, we have kind of similar numbers in British Columbia and Fraser Health, and we basically can say that inside deaths are representing 85%, whereas the outside deaths are those that are representing approximately the 13%, between 13 and 15%. So what this means is that having illicit drugs, or the use of illicit drugs, it's taking people to use inside, and sometimes in hidden places where unfortunately there's nobody that can provide the support that they need in case they overdose. So I'm just gonna pass this presentation to my colleagues so they can continue and explain to you some of the alternatives that we want to present today. Thank you.
Okay, hi, I'm Ajaz Mohammed. I'm the project leader for the Health Contact Services project for this portfolio. So we wanted to show this diagram just to give you a picture and an overview of what we're talking about when we talk about health contact services. So at the direction of the Ministry of Mental Health and Addictions, and in partnership with municipalities, nonprofit agencies, and others, Fraser Health is working to implement these health contact services for people who use substances, providing access to services across the continuum of public health and mental health services, which include but are not limited to witness consumption. And this is because there is an identified risk for coordinated access to health services for individuals who use substances across Fraser Health. And currently, overdose prevention and harm reduction services offered in our region include harm reduction supply distribution, peer-based harm reduction outreach, take-home naloxone training and distribution, drug checking, witness consumption, sharps recovery, and linkages to health and social services. And so what Fraser Health will do is we will issue a request for proposals to service providers in the community that are able to provide this service in partnership with the city, the community, and Fraser Health. And so we will issue this RFP on the BC Bid platform, and that is available for public viewing. What we're able to do is actually provide key contacts from both the Township of Langley and the City of Langley, because we will only issue one RFP for both. We can provide copies of the RFP to those key contacts once posted. And so I'll let Aaron get into a bit of the overdose prevention sites and the overview.
Thank you, Angeza. So I'm just going to briefly go over a bit of the overdose prevention site component of a health contact center. Next slide, please. So overdose prevention sites are spaces where people are provided with a safe setting to use their previously obtained substances under the supervision of someone trained to recognize and to respond to an overdose rapidly. This rapid response to overdose is a key component in preventing brain injury and death. Generally, OPSs are staffed with a blended model of people with lived experience with substance use and harm reduction workers. And these sites operate under the provincial ministerial order that was issued by Terry Lake in December of 2016, after Dr. Perry Kendall issued the provincial public health emergency. And they're different than supervised consumption services, which are legislated federally. Next slide. So often there are a lot of myths and misconceptions about what overdose prevention sites do. And sometimes it's sort of thought that providing an overdose prevention site will normalize and enable and encourage drug use. but that it really, from all the evidence that we have, what we see is that people that access these types of services often have long sort of histories of substance use, and they don't increase substance use or normalize it, but that often is the first step in redirecting people's healthcare outcomes. Next slide, please. One of the misconceptions is also that OPS sites will increase public disorder, and they can reduce what we know, again, from the evidence. There's research that looked at over 75 studies of comprehensive research studies looking at all the different crime determinants. And what they found was that OPS services can reduce rates of public drug consumption, significantly reduce the amounts of inappropriate discards surrounding the area, and have reduced impact by reducing property crime in the surrounding area, and then have sort of neutral effects in other sort of crime aspects. Next slide, thank you. So another piece that is often misconceived is OPS is just a place to use drugs, substances, and other things will never change for those individuals. An OPS is just one pillar of a comprehensive strategy in engaging folks on their substance use journey. And so it's often an entry point for healthcare and other supports in connections and referrals to treatment and recovery, including opioid agonist treatment, detox if that's something that somebody wants, residential supports and services. And it's also a place where people often find and can connect to purpose, find community, and be able to volunteer and provide connect to peer supports. The OPS services are often a lot more low barrier than some of our other health services, and so really can engage folks in lots of different ways. Next slide, please. So really, when we look at the number of deaths that we've seen across the province and including Langley, one of the big benefits and priorities is the reasons why the ministry has really put this as a priority is that despite having, some sites with like hundreds of injections or consumptions a day, there have been 0 deaths at an OPS or an SCS anywhere in BC, in Canada, and internationally. It allows for rapid intervention for emergency response, can potentially lead to reduced calls for emergency or first responders, including ambulance, which can free up resources for other emergencies. It can reduce public consumption of substances and discards, and it also is an entry point for people to sort of rewrite their experiences with the healthcare system or other systems in general, where people who use substances are often met with stigma and discrimination. So it's a safe and non-judgmental space. What we know as well is that it also has positive impacts on reducing bloodborne illness and infections by providing an access to sterile equipment and also places for people to dispose, can reduce healthcare expenditures and hospitalizations connected to those infections, and increases referrals to supplemental services. What we know as well is that people that access a service like Insight in Vancouver, that people were 30% more likely to engage in treatment services. Next slide, please. Dan.
Yeah, so thanks, Erin. So what are the next steps? So what Fraser Health is looking to do, as and Jez had previously mentioned, is that we want to post a request for proposal on the BC bid looking for potential proponents to provide a OPS service as well as a health contact service in Langley or City of Langley or Township of Langley, depending on the site. We want to put the posting for the RP up sometime in February, so potentially in the next week or 10 days or so. And it will go through the public process. We'll identify the possible applicants and go through a screening process for the service and then interview the possible proponents. We've done that and are in the process of doing that in a number of other Fraser Health communities following the same process. So that's, I believe, the end of the presentation. So if there are any questions, we can certainly entertain those if you have any for us.
Great, thank you so much for that presentation. There's a lot of information there. Who would like to go first? I have Councillor Storteboom.
Thank you, Madam Mayor, and thank you, Mr. Kipper and your team for coming out today to present to us what you are considering. Please let me preface my remarks by stating that I have great admiration and every respect for our frontline healthcare workers and our emergency service personnel who risk their lives every day in this opioid crisis during a pandemic. As an individual and a representative, please know that I want to demonstrate good policy around this very real concern with empathy, understanding, and compassion. I may not be familiar with all of the terms that are familiar to your area of expertise, so please excuse me as I try to make myself known. I do want healthy relations with our regional healthcare provider and our provincial government. However, I feel very threatened by the initiative that you are proposing. And it may be around the stigma that you've identified, but please know that this is familiar to residents in my community, and it needs to be addressed to the best of your ability. I'm a salesperson by trade, and I want to work with you, but I can't sell anything I don't believe in. So please try to make me a believer in this, okay? The location of the proposed overdose prevention site will be most challenging. While wanting to provide ease of access to clients, I'm sure that there will be a negative impact on the surrounding area. I've watched Seattle is dying. I've watched Fighting for the Heart of Seattle, the Soul of Seattle. You know, that's scary stuff. I don't know if you've seen it, you should. This is what people are looking at on YouTube. I expect that there will be an increase in drug trafficking in the immediate area and criminal activity associated with that. That just makes common sense to me. You may say otherwise, but I'd like to have you convince me. Can you assure me that this will not be the case at a site in one of the Langleys? I guess that's just an ongoing conversation, and hopefully you'll be able to come up with something for me. I'm also concerned about contracting site services out to a third party. In doing so, the operation is put at arm's length from Fraser Health management and policymakers. Who can residents hold accountable if there's a problem at the site? Do they have to go through the service provider? Because the service provider will try to protect themselves, of course. And I'd rather that it was run by Fraser Health and not necessarily a third-party provider. I am concerned about who that provider may be. I'm also concerned about the details of the request for proposals. They're not really fully known to me, so I can't comment much on them, except to ask for a comprehensive public input process from our community before releasing it, and after a suitable contractor has been considered. Still, I do have some questions that I hope you can answer around the qualifications criteria that would be used to evaluate potential providers. Is something that you're going with familiar service providers, or is it open to the public? And is it, for the lowest bid? What is the term, the length of the contract for the service provider to operate the site? Is there a renewal clause? If so, how long and how many times? Is there a termination clause? And what's contained in such a clause? Is there a subcontractor clause or a default clause in the RFP? The business model you suggest is very narrow in its scope, and it can be immediate, and it does not seem to include a full complement of support services. Are there any wraparound services being included for the OPS? You've got different types of sites and different criteria that go with them. And again, I'm not necessarily familiar with all of the criteria for all of these different designations that you have. So I would appreciate knowing, what kind of wraparound services you might have to include with this presentation. What do existing OPS sites have for such support services? Please excuse me for saying so, but the authority that you have in establishing this site in my community is especially intimidating. Are you and your contractor fully prepared to address our concerns? I have more questions, a series of questions and concerns. Isn't there a concern that clients attending a site may drive while under the influence of controlled substances? Who will be responsible if there's a serious accident? Why, during a pandemic, is a physical location necessary, especially when the biggest concern is overdoses in homes? Has Fraser Health considered virtual counseling and in-home services? Have you considered just expanding your home care service to include overdose prevention? I'd like to know more about the overdose agonist treatment site that Fraser Health has already established here during a pandemic with an average of 121 monthly visits as reported by Fraser Health. Why isn't this converted to a mobile service? As a medical and mental health issue, why wouldn't an overdose prevention site be better suited in a hospital setting where additional emergency services are readily available? How many overdose incidences occurred in Langley City in the past 3 years? Can you break that out? How many deaths have we had? What are the numbers? Can we see a report on Langley City? Because that's the concern here. We have a small community, and I believe it's going to be significantly impacted depending on where this location is. What are the ages of the individuals who are experiencing overdoses and dying? Can you break these down for me? How many overdose incidences were at individuals' homes in Langley City relative to public spaces? From what I see in the Fraser Health model that you present with a graph, it looks like it's especially concerning about the increase in overdose deaths in individuals' homes. This suggests to me that a mobile model might be more appropriate. What has been the experience of other communities where OPS sites are introduced? Is it available for council to visit an OPS site? Will the Fraser Health Authority be consulting with policing services and local social service groups like our Langley Stepping Stone Society and Compass Society to get input before actually issuing the RFP? Can the RFP be drafted to have the successful proponent locate the OPS outside of our downtown core for a specific land use designated by the city? The opioid crisis overdoses reported have spiked over the course of this year. What resources are currently being used to deal with early intervention and possible prevention of opioid overdoses? I want to know more about Fraser Health Authority strategies in communicating and managing the ongoing opioid crisis. As a community partner, I want a more dynamic and transparent relationship between Fraser Health and our community moving forward. Maybe then we could talk about other important related issues around certain strategies, including the concerns that I hear from citizens around maybe a class action lawsuit against pharmaceutical companies that have contributed to the opioid crisis. COVID vaccines are being developed and distributed with surprising speed because of the virus emergency. Are there any less addictive pain treatments being developed? Our public spaces are precious to us, especially during this pandemic. Is Fraser Health still freely distributing hypodermic syringes in our public spaces? Why doesn't Fraser Health distribute retractable needles? As you know, Langley City is witnessing a drug addiction and homelessness situation every day. Now, since the COVID-19, many who are homeless have been placed in temporary housing. Is Fraser Health promoting the benefits of keeping this Housing First initiative for the health and well-being of these clients? If we return to what we had, we can expect our bylaw, policing, and medical emergency services to be overwhelmed again. Is there a plan to add to our intensive case management team that already has a full caseload? I don't think that I'm alone in feeling especially anxious about this initiative. What plans do you have in providing public consultation and receiving input from our community? We've been following COVID protocols for a full year now. We're all frustrated and we don't need any more stress. What can you say to our residents to calm the very real concerns that they have about establishing what is commonly referred to as a safe injection site here? Is Fraser Health effectively managing the opioid crisis to reduce overdoses and drug addictions? Or are you building a business model at our expense? Tell me, how will this benefit Langley City? Thank you for hearing me out. I hope you can answer my questions. Thank you, Madam Mayor.
Thank you, Councillor Sturdivant. I'm not sure where you want to start on that.
Well, what I might suggest then, thanks, Councillor Sturdivant. It's for a very thoughtful, well thought out number of questions there, and a number of those questions certainly we'll be able to answer. And what I may suggest, if you have them in writing, we can certainly take them away. If you could send them to us, and we'll try to provide a fuller answer to them. I think as you're reading through many of the questions, we have been posed some of those questions in some of the other communities, and certainly could provide a more robust answer than maybe what we could provide right now. But maybe before we leave that, I just wanted to mention that certainly we want to work quite closely with the community, both in terms of the council, whether it be Langley Council or Township Council, as well as the service providers. We want to make sure that they are good partners. They're certainly good partnerships in other communities as well, to have consultation from the community as some of these resources are developed. But certainly many of your questions are well thought out, and would be more than happy to provide a fuller answer to them for you.
Well, thank you for your reply. I guess that's Mr. Kipper. I don't see your face here. I see.
Oh, sorry.
Live still, but
yeah.
I'll ask staff if they'd be kind enough to forward your email address to me, and I'll be happy to send you along what I have been considering and asking. And please note too that this particular presentation will be presented on YouTube for public consumption. So any additional information regarding answers to specific questions that you feel need to be said, you're welcome to make yourself known in these regards at this time for the general public who may be watching this now or at some point in the future.
Right. Did you want to answer some of those questions now? Or did you want to hear from other council members, or?
Yeah, maybe other council members. There was such a long list of questions there, it would be hard to pick out one or two to specifically talk about them, unless Councillor has one or two that you would just like an answer to right now.
Well, sure, if that's okay. I have a serious concern about clients attending the site who may find themselves driving under the influence of a controlled substance. I can't see the logic in this. How do you see this playing out? Who will be responsible in the event of a serious accident?
Maybe, okay, thanks for the question. And I'll maybe ask Aaron. Aaron, you have some experience in this and could maybe provide an answer to that.
Yes, and thank you, Counselor, for your thoughtful questions and bringing forward a lot of deeply held and emotional and heartfelt sentiments to representing the community. I think that to answer the question about driving under the influence, I think that having a supervised consumption site or an overdose prevention site does not give permission for people to use substances in ways that they wouldn't have before. What I do think is that there are lots of places across all of our communities where unwitnessed injection sites are happening. So these are happening in people's cars, as we've seen in the media recently. They're also happening in different fast food restaurants or in gas stations. And people are using in these spaces unwitnessed without any supports for staff, from staff. And so the benefits of having a site where substance use can be witnessed is that staff will be trained in how to manage and invite people to stay longer, and that that people wouldn't be driving or encouraged to leave places or being knocked on the bathroom and being kicked out of places, or leaving, young individuals who may be at their first job being called upon to respond to overdoses in really startling and unprepared ways. And so that is the benefit of a witness consumption site. And I think that what we've seen is that people at these sites, and the RFP process goes through that, is that the value adds that the operator can provide, providing a chill out space where people can have snacks and connect and be in community, that they're not immediately getting behind the wheel of a car and driving under the influence.
Well, thank you very much for your answer. It's just that the modeling that you present in the graph is that the overdoses at street level are relatively the same. It's the increase in overdoses in homes that is the concern. What would prompt a client to leave their home to go to a site to be supervised when it's their wish to be at home? I think that an in-home service is much more practical and appropriate. I can't see that people who are in their homes will prefer driving to the site and then driving home again. So I think it's a valid concern, and I really don't know that we're addressing it like I would prefer. Well, why isn't this something that we can have up at the hospital now? Why can't we extend home care service?
And I guess there's a few things that are running through my mind, and I look forward to your list of questions so I can answer them more comprehensively. I think that what we do know is that people actually don't travel too far to access these types of services. And so we want to bring them to the locations where overdoses are happening. And so looking at maps and GIS sort of tracking of where overdoses are occurring, we want to locate these services so we can draw folks. So instead of consuming substances in an unwitnessed bathroom stall, that they can be brought in and connected to services and supports, potentially having the substances that they're about to consume checked with drug checking technology so they can make informed decisions about their substance use. And I think, yeah, that's part of the hopes. I know we, across the province, we struggle with engaging individuals who use alone in their homes. And maybe it's they only come to the site once, but that they know that their substance use won't be judged or stigmatized, that they connect to services and potentially they learn how to download and use the Overdose, the Lifeguard app, and we just connect them to other referral supports, potentially the substance use services access team, outreach workers, those kinds of things. In addition to another part of your question is that they're about Fraser Health staff or hospital sites doing this is that the province has introduced episodic overdose prevention services, a guideline to support individuals witnessing consumption in more informalized ways so that they can witness consumption and respond to an overdose of their clients in community. And so that is an additional aspect to a health contact center slash overdose prevention site that Fraser Health is working on.
So is there any consideration to having the site at the hospital?
I was looking to Dan to see if I should answer that question or.
Yeah, well, I can try to answer that. There is some thinking and planning about various sites within Fraser Health. Some may be located at mental health centers potentially. Again, that's in relation to what Aaron is saying about episodic overdose prevention. So I think the OPS that we're proposing here is just one aspect of us addressing this issue. And you had mentioned earlier about how do we reach people who are at home overdosing, and there is there is some planning going on, and a pilot currently in Surrey that could be expanded within Fraser Health about working with second responders and as they respond to overdoses in homes to provide contact information to the supports that we can then provide outreach to after the fact. So we do recognize that that is an area that we do need to focus on to try to address some of the issues that are happening behind closed doors. So I think, yeah.
I just think though that it would be better if we were proactive with the mobile healthcare home care service, because quite honestly, when people are overdosing at home and the city gets the call, we have a mobile service to try to save their life by coming in after the fact. Mm-hmm. So I think a mobile service to try to help them before taking the drug, before the injection, it seems like a practical way for the client to feel comfortable in a setting that is familiar to them. You have a home care service for others. So I just think that considering the business model that you're bringing forward about dealing with people who are living and using in their homes, this would be the more practical solution. And, forgive me for belaboring the point. It makes sense to me. But I'll step back now and see if any of my other council colleagues have anything to say, okay?
Great, thank you. Councillor Martin.
Thank you very much. Just a couple of questions that hopefully you can answer, and some of them were in Councillor Stordeboom's. Can you give us a breakdown between the city and the township?
Aaron, do you know those, that's in terms of the overdoses, Councillor? Aaron, do you know, yeah.
In terms of overdoses, a breakdown between the city and the township.
Overdose deaths or overdose, I don't have the numbers right in front of me. I'd have to check with the data steward. So the deaths are not our, we have to check with the different people, and so I have to check on the numbers on those. But are you looking for the deaths or the ambulance 911 dispatch calls?
I'm looking for the deaths and the overdoses that are attended to.
Okay, I will ask our observatory and our EPI and see if we can give you a further breakdown.
Okay, thank you. Is it all types of drugs that would be used at this OPS site, like heroin, cocaine, meth, all of that kind of stuff?
Yes, whatever folks bring in, that's for their consumption, yes.
So basically, it's my understanding that the safe injection sites do they deal with all drugs?
Yes.
So to me, this is like a safe injection site, not an OPS. I mean, if someone's shooting up heroin and you're watching them, to me, that's a supervised injection site. It's my opinion. some of the comments that were made by Councillor Storteboom, I tend to agree with in regards to if I want to, whatever, shoot heroin or whatever you do with cocaine and meth, am I going to stop and think, well, maybe I should go down to the OPS site? It's raining out, it's snowing out. I think I'll just shoot up here. I just can't see people leaving their home to go down and do whatever they have to do. And, you know, you in one of your slides, you said that the OPS sites reduces public consumption, reduces discards, it's down, property crime is down, and yet only 13% is happening outside. The other, I think in private residence, you had 69%, and there was another number that I didn't catch before the slide was changed. So people that are consuming in their homes, they're not outside consuming this stuff publicly. They're not discarding their stuff on the streets, and they're not out committing property crimes. So, you know, that to me, it may happen in the 13%, but it's such a small number that I don't think it's kind of even irrelevant in what we're looking at here. I tend to agree that a mobile site would be probably better, but again, I'm not sure how that works. Obviously now if somebody overdoses and the wife or the girlfriend or whoever is there calls 911, the fire department shows up, but how would a mobile service work? They're not there to save somebody's life. They're there to prevent overdoses. So when someone wants to shoot up, do they say, I'm going to shoot up, send the mobile unit? I don't know how that would work. I also think that a hospital would be a good place to have something like this in case there is further work that has to be done on the patient. And I guess the other thing that was just mentioned in regards to what Councillor Storteboom was saying, you said that you know you can GPS where these overdoses are taking place, and this has got to do with driving to it. I don't know how convenient it would be if it wasn't located in the downtown core. And I'm of the same opinion. We do not want it in our downtown core. So it'll be interesting to see where it happens. And I guess the other thing, I'm not sure as a council, we have any say. If Fraser Health wants a consumption site or an LPS site in a certain spot, what say do we have? I don't know, even if you're not zoned for it. So that doesn't sit well with me either. I think that's about all I have. Thank you very much.
Councillor Albrecht and then Councillor Pahal.
Thank you, Madam Mayor, and I want to thank you, Dan, and your team for bringing this presentation forward. As you can see, there's a lot of questions, anxiety, apprehension. I too have a little bit of that myself. I've got a couple of questions that I would like to ask. I heard that you're talking about one site for the Langleys, and I was just wondering how that was determined. Is there thresholds where, you know, it just determined that one location, and why not one in both Township and Langley? How many does Surrey have? Are there any plans for Aldergrove or Abbotsford? Those types of questions. There's a lot of unknowns. We haven't talked to our service providers in our community. I think we need to have those kind of conversations. So I'd really, at this point in time, I'm one of these guys that likes to do evidence-based decision making, and there's a little too many unknowns. I know FCM has done up a paper, the opioid crisis, with all the mayors across Canada, and they're trying to get all levels of government to step up and do their part to combat this thing. Yeah, it's a crisis for sure. There's no other better word. And I think we all have a part to play in that, and we as local government do as well. But we need all the other levels of government to step up and help with this, because it's not just a one solution thing, or else it'd be already fixed. There's so many complicating issues here, and we need to make sure that this is just not providing a continuation of the same problem and having it growing. This is a symptom of some bigger issues. You know, the economy and wages and earnings and being able to afford things in life, being able to afford a home, being able to provide food to your family, being able to provide medicines and healthcare. This is just a spiral that is like a tip of the iceberg. So there's a number of things that need to be taken care of. We really need to have some engagement with our partners in our community that provide services. I don't even know if we have adequate qualified professionals to deal with a lot of the issues around mental health, addictions, trauma, head injury, you know, you name it. There's a myriad of people that need to be part of this. So what I'd really like to ask is, can we get the brakes pumped on this thing a little bit for the RFP? Let's find out a little bit more information, and let's have some further dialogue and answer some other questions that have been brought up here earlier tonight, and try to put our minds at ease, and as well as our residents on what's going to be there. Because I can see these like Councillor Martin was talking about, the 13% outside. I could see them taking up 50-60% of the time, using this as a drop-in center to get out of the weather, get out of the off the street, and be able to sit down comfortable, warm, and taking up a lot of time. And I know these kinds of services are, and same as the OAT clinics, are for people that really want to make a change in their lives. And a lot of them will make those connections and those inroads into providing the kinds of service to help them recover. So I don't want to say that I'm totally against this, but at the same time, I like to move cautiously and have all the information available. And again, yeah, thank you for your time and the presentation.
Councillor Pahal and then Councillor Wallace.
Thank you, Madam Mayor. And I think I'm going to tell a personal story about substance abuse in my life, because I think it's important for this conversation. And this is a story my father's told, so I know I have his permission. So my dad used heroin when he was young, in the 70s and 80s. He actually ended up shooting himself in the foot because of it, because he got so high one day. He switched over to using abusing prescriptions, basically, so using morphine. And I know what that was like. I remember we were camping once, BC campsite. He overdosed, had to go to the hospital with him. It was just you and me. So I know the trauma of what this is for families. And I'm going to see how it was helpful. So back in the 90s when this happened, they did the methadone treatment. I don't know if it was new at the time, but that was something that he was able to get on. I remember we got the treatment in a doctor's office. It was on like the second floor. I remember that clearly. I went with him. And I believe that sort of service, I think we're calling it OAT now, it saved him, it saved our family. So I know this is really, really important stuff we're talking about here. One step removed, I worked in a company I work for, PNI Media, is located at Carroll and Pender. And that's where one of the first safe injection sites was located. And prior to that, I worked for Channel M in the same neighborhood. So I also saw the difference of how these services actually help the community they're in as well. From my perspective, I see personally from my own life how it saves people and how you can connect people. And I can see how these things can improve the communities in which they are as well. And I've seen that firsthand. So with that in mind, I guess for me, I want to know, like, how, when you're developing this, will you create a space that feels safe for people like my dad, who isn't someone I think people would typically think of as someone who uses substances. How do you do that in a way that is, uplifts the client, gives them a safe space, makes it not seem like there's stigma? And also, how do you do this in a way that uplifts the community in which you serve? And I'll kind of give you some other context about what we're trying to do in Langley City. And I really look forward to working collaboratively with Fraser Health on this because it's so important. So, for example, we are working on our new downtown plan. And one of the things we want to do is make sure that our ground level is shops like retail stores, cafes, restaurants, things like that. And we're really trying to discourage services. So I'm not saying, like it could be clinics, it could be, childcare, hairdressers, really just kind of service businesses. So this is, not picking on any particular kind of service, because I know that's maybe where people may think, when we're talking about this conversation right now. So how can we, while we're uplifting our community, place this in such a way where we can activate the streetscape, create like an engaging core, which we're trying to do, shops and restaurants, but still also have these places where people can go, feel dignified to go to as well. So I guess the two questions for me is important for the client, so they'll go there and not feel stigmatized. And also, how can you do this in a way that supports our downtown, our goal of creating activated street fronts as well? Because I think it's possible. And I really look forward to getting all of council's questions answered. And I really hope we can be a partner in this, because I think working together, we can come up with a real great solution for our community. Thank you.
Yeah, so thanks for that question, Councillor. We certainly do want to work in partnership with the city and or township, depending on where the location may be. We wanted to work in partnership both with the municipality, but also with the service provider. Any agency who's selected will have to provide consultation to the community. That's an expectation in the RFP, that there'd be public consultation in regards to the service, and in some situations even having an ongoing community table where issues can be brought forward and course corrections made. In terms of the welcoming space, I'll maybe ask Erin, who again is our kind of resident expert in this, in terms of her experiences with some sites and how they've managed those situations to make it inviting, not only for individuals who may be in the street, but also individuals who may be coming to use not only that service, but some of the other ancillary services that might be there. For example, drug checking, linkages to other services within the community, etc. So, Erin, do you have any comments about that?
Yes, and thank you. Thank you for your question and your sharing of your sort of family history. It's I think a very important aspect of I've lost people that I love to overdose, and so when I think about these services, I think about the 161 individuals in the community that have lost their lives, and some of them I know and have had deep connections to in the city of Langley, and so in the township of Langley, and so I think that the primary thing that I've seen, so I've been working in harm reduction for over 20 years, and the main thing that I see that these kinds of services do, I see them as dignity doing and purpose doing, and people find connections, and I know for a lot of folks they don't have family supports, and so that a lot of their connections and the things that they have found meaningful in their life previously have been disconnected because of their substance use. And so services and spaces like this really restore that that sort of sense of identity, that you're more than your substance use, and there's lots of ways you can contribute, and so people feel connected and cared for. Those connections raise the expectation, they are able to contribute, and those contributions raise the expectations for themselves and how they participate in the world. And so in doing that, I've seen really amazing things happen in terms of community beautification and people really taking ownership of the space. and wanting to give back. So we have community programs that Fraser Health has funded and has actually worked with the city and the township on engaging people with lived experience and beautification, so community cleanup, and really wanting to be part of the solution. And so I see it also as a way of building community safety, so that people, instead of feeling afraid of people that look different than them, that they actually feel safer and they feel like they have neighbors, like it's a neighborhood. And so I think those are some of the pieces that I find a lot really hopeful in an opportunity like this. So I think, yeah, hopefully I got all those questions there. Yeah.
If I may
Yeah.
add something to this, please. Having the chance to provide care as addiction physician to this population, it's been a great way to understand what these might be. If this wouldn't be something that complicated, we wouldn't be spending an hour or more discussing and thinking about all the questions that we've been asked. Those are completely important questions. And as a citizen, I feel I feel basically all of those same concerns. But again, as a physician and as an addiction physician provider, I can tell you that for some people, this might become an important issue when someone around them is affected by the situation. And it's not only when someone is using, it's when someone is dying. That's when the situation takes the peak. What we are proposing here is basically one tool among the many that need to be implemented. This is not something that it would be resolved with just one particular action. It requires different actions, not only like it's been told, not only by Fraser Health or by the local government. It requires a lot of commitment and also actions from everyone. So what we're trying to do with services like this is opening the door to people who going somewhere else just don't get the treatment. And I'm not talking only about the medical treatment. I'm talking about the human treatment that everyone deserves. I completely understand the fact that we are presenting data that is showing that the majority of deaths are happening indoor. But what I'm seeing is that we are all thinking that this is happening just because, you know, it's more comfortable for me just to do it at home. Why don't we ask ourselves, what if maybe the reason for seeing those indoors is because, you know, the stigma that we've put as a society into this, the illegal part of it that doesn't allow me to do it where I could do it safely. And just to address some of the questions that we heard about, you know, developing other kind of ways to provide the service, especially in home, those are things that we are exploring and we are implementing. However, consider that in order for a treatment or a strategy to be successful, it requires different parties. And unfortunately, the party that is the end user, someone who is using drugs inside, it sometimes is not there. So we definitely need to have long conversations about education to the population, about making these services available. And again, what we are proposing here is just one tool that might be part of the solution. I don't want to expand more into this, but I do want to say thank you to Council Nathan for providing that personal history. As this basically explains what the situation is. And again, I think this is a concern only when someone around me has this particular issue or is dealing with an even worse situation that is passing away because of something that could be prevented. Thank you.
Thank you. And if I may follow up, Madam Mayor, I think, thank you for sharing that. And I'm glad that you're looking at it this way. And I guess I'll follow up, again, just looking at my dad, I don't think he chose to use the way he used it. Was something that he was almost forced to do. I can't explain it, but you don't make a conscious choice when you're doing that, when you're choosing to hurt your family because you want to use. So it's something beyond that. So I'm glad that you're looking at that kind of place where you can serve people with dignity. But I also just think we can be a partner to make sure how this is set up in our community is uplifting. And I think we can do it in a way that works with, I think, our objectives to building that complete community where everyone is welcome, and I do mean everyone, and in the way that we can create a really, really engaging place. So I just hope that as this moves forward, as you're working with the RFP and the proponent, that our city, our staff are part of that conversation. Because I truly believe that good urban design makes great spaces, and that how you create any kind of place, and I think even more important, a health service, it's key that we get that right. We need to make sure that the health service is integrated in our community in a way that uplifts the whole community. So I know you folks know this at Fraser Health, but it's just something I'm really passionate about as well. So again, I look forward to working with you, because I think we can work well together. Thank you so much.
Thank you, Councillor Wallace.
Thank you very much. And thank you, Councillor Nathan Cole, for sharing your story, because I think in sharing stories, it is so important, because it helps us to understand where people are coming from. And, Nathan, you just said, it wasn't of my dad's choosing. And a lot of times that is the cases. I see this as saving lives. I see this as mending families. I see this as another tool and another support for families and for that person that is needing to be held and taken care of. And you know what, I think, we have many methadone pharmacies here that, give out methadone. It's not a very dignified, approach to go into a pharmacy and have to take your methadone right in front of the pharmacist. If there were ways to, for people to understand addiction and the stigmas that come around it, I think that people would be willing to get the help a lot faster than they do, instead of being so afraid to tell somebody of their addiction and before it's too late. And I've known people where it's become too late because they were afraid to tell people of their addiction, and young people. So do I think this is necessary? Yeah, I think it is necessary. Do I think it is one tool of many, many tools that need to be, that we need to be equipped with within our community? Yes, I think in the way that we design our communities, as Nathan said, in understanding, acceptance, and we are all human beings. We are all human beings, and we never know what comes our way, or what might come in the way of a sister or a brother or a daughter or a son or a father or so on and so on. So I'm willing to, I think it's really important that we have to work together in the best way possible for the community of Langley City and the residents, and saving one life, just the ripple effects of saving one life is enormous. So thank you for your presentation.
Councillor James.
Thank you, Madam Mayor. Yeah, I've been sitting here very carefully listening to everyone. So I want to preface everything by thanking Fraser Health for being here today. We loaded on a bunch of questions. I want to thank my council colleagues for covering most of them. And I think the only thing that I want to contribute, which is how I feel about this, is location is essential. If we're trying to destigmatize the people that use drugs, I don't think popping them in a location that's right in the middle of everything and activity and what, I don't think that's going to help. And I'm not suggesting it be tucked in a corner somewhere like a dirty little secret. I'm just suggesting that I think when an organization is selected, when this happens, that location is imperative for these people that are going to be using this facility. Just because, yeah, I can't see if it's like, you know, smacked right down in the middle of the downtown, and I have to be careful here because it's not about not believing that this is a service that's essential. I just really genuinely think that location is going to make or break the success of this outreach thing. So yeah, I just wanted to thank everybody for their very well worded questions and responses as well from Fraser Health. And again, I see if we work together, if it does end up in Langley City, I think that this will be far more successful than if we combat one another and don't communicate. So just wanted to add my 2 cents. Thank you again for your presentation.
Councillor Sturdivant, did you have a?
Thank you very much, Madam Mayor, and thank you to all of my council colleagues for your questions and comments and for your personal stories. I too recognize that we are in a crisis, and I appreciate that the good doctor advised that his concern was associated in large part around the stigma. And I can agree that the stigma is a genuine concern, but that has been established over time. We're looking at an emergency situation now. Stigma will be diminished, but that will have to be over time. We can't do that overnight. What we're looking at is dealing with the immediate, and the numbers that you're showing me are telling me that we have an especially significant problem with people using at home. I think it would be much more dignified for these individuals to be able to use in the comfort of their own home. I would suggest that we really lean heavily on the home care model. I think that you've got the resources, and I think that that's the practical best way to do this. And I think you should actually extend it to the opioid agonist treatment as well, considering the numbers that have been identified. I think the business model is there. So please give that some consideration. There's a lot of conversation that we can still have. We need to, collect our thoughts, collect our questions, send them to you, maybe have a follow-up workshop at some point in the future where we can actually, stretch out some of these questions and concerns, feel more comfortable. The thing is that we don't talk with you guys as much as we'd like to. And maybe there'd be less anxiety if we had, a more transparent, ongoing relationship. So let's start with that moving forward, and then maybe bring this situation, this particular crisis to our community and ask for their input and hear what they have to say and try to address those concerns that some of them have been raised today. So I'll look forward to collecting questions with my council colleagues and forwarding them to you, Mr. Kipper. Thank you for you and your team coming to us today. And thank you for willing to hear what we have to say and following up with us in the future. Thank you, Madam Mayor.
Thank you. Yeah, thank you so much for coming. I think this really is just one piece of a puzzle, and it's going to take a long time. This isn't going to be something that's going to be fixed overnight. We're dealing with COVID-19 right now. So I want to say thank you to you and your staff for everything you're doing for us. It's been a very trying year. I know working in the medical profession, you're dealing with it at some level all the time. So thank you for keeping us safe. I think this is one more thing that if we can just save one more person by doing this, I think it's really important because everybody is a part of our community, no matter who they are. And we're, as council, we should be looking after everybody in our community. So I do have a few questions. I guess first off, a comment. I do have serious concerns when you tell me that fentanyl, the concentration has doubled. And with that, my question would be carfentanil. And to that end is, what do you see in the future? Like, is this a serious problem? Because I know a couple of years ago, the concern was the carfentanil coming in. And now with the borders being shut in Australia and China that were our top producers, what is being done to like look for drugs coming in and that sort of thing?
Yeah, I'll ask Aaron to comment on that, but you are right. I think certainly the concentrations of fentanyl are significantly increased, and so it's showing up in many areas, not just in individuals who are regular substance users, but even recreational users. And it's really unfortunate because it's really touching many people who it hadn't touched before. The pandemic certainly has disrupted the supply chain. So again, drugs that were coming in from offshore certainly have been disrupted. So people locally are making them, unfortunately, not to the same standard, if you will, as they were getting them offshore. So that's causing all kinds of problems as well. So, Aaron, did you have some comments just around the carfentanil piece and your experiences with that?
Yeah, and so thank you for that. Thank you. What we've seen so the DAS lab does urine drug screens. And so while we see the concentrations of fentanyl in general significantly increasing, we're not seeing that necessarily being carfentanil. So it's fentanyl and other analogs and just the makeup. And so as Dan was alluding to, and this is where I think E-Division and other sort of border folks would have more intel, but from my conversations, because the borders are closed, it's sort of opened up newer individuals who don't have as much experience with the manufacturing process and sort of getting the quantities right. And so this is where we're seeing some of the increase in concentrations of, instead of diluting it in a certain manufactured process, we're not seeing that same sort of diligence or experience in doing that.
Great, thanks. So in regards to the overdoses, the drug checking, are you doing any sort of campaigning with bars and restaurants, maybe the labor industry, construction, the trades, anything like that, to offer kits for people to take home to do the drug testing at home or even in a restaurant or bar? Because we know that's where a lot of people are doing their recreational drugs, is in a bathroom stall at a restaurant or out at a concert. I know we're not dealing with that right now, but at the same time, what you were talking about, going into a Tim Hortons and using the bathroom, right? So is there a way we can make these drug kits checking more available?
Thank you for your question. And so we did do a large push campaign and an ad campaign using the lifeguard promotional materials. So promoting that across bars and restaurants across the Fraser region, as well as having business cards promoting the lifeguard app put into naloxone kits. And with the drug checking technology, our harm reduction sites offer take-home drug checking, so the take-home strips. So once people have been trained to utilize the fentanyl drug checking strips, then they can give them to individuals to test their drugs at home. Again, not super helpful for opioid or down-like substances because those are all contaminated with fentanyl, but particularly useful for people using stimulants that can see if their stimulants have fentanyl in them. And like Dan said, so anyone that uses substances, whether they have a problematic relationship or would be designated having an addiction, or they're just using once in a while, they are at risk for sudden death of overdose. So definitely looking at creative strategies. Fraser Health, we also know is that the sort of more advanced drug checking technologies like FTIR machines, so Fourier transform infrared spectrometer, these fancy machines can give a bit more of a detailed printout of what is in the substance. So people like Consumer Reports having more informed decisions about that, knowing a bit more about the concentrations. We're also seeing an increase in benzodiazepines in the substances. So that really complicates the overdose response. That naloxone doesn't work for benzos. And so what we see is that people at different levels in the supply chain will potentially come into sites that have one of these machines so that they can protect the people that they're distributing to. So lots of different creative ways to engage folks wanting to test their samples, and seeing people that are picking up to use on a weekend or go to a festival, getting their drugs checked at these sites.
So that's what I believe Daniel was saying earlier, that just one time stopping in and getting the information, is that where that would kind of come at play, so to speak? Yeah.
Yeah.
Okay.
Yeah, and learning about the app. Our substance use services access team, so there's people that have overdosed and gone to hospital, and our substance use access team follows up with them. And the person might not be interested in treatment or different things, but they may be interested in engaging in an app where they can remain anonymous, and if they don't respond in a certain amount of time, EHS is dispatched and they gain access to the building and can save people's lives.
Now, I love that idea, that app. I was following it while it was being developed and implemented. Now, is there any sort of way for that to go real time with FaceTime or anything like that? How is that what the next step is going to be, do you think? Or
yeah, there's some other app technology. So the Be Safe app was is developed, and it does have the FaceTime peer witnessing aspect. And I know that there are provincial peer networking groups that are working on promoting the FaceTime piece for people that feel comfortable with that. But I think for a lot of folks, and Lifeguard is keeping track of these different things, and I'd be happy to share their latest report with you on who's using the app and why. They're actually engaging in a survey to get feedback from people on how to make the app better, but also protecting their anonymity. So recently, anyone can download the app, but recently we had a concentration of overdoses in Surrey. So we were able to give Lifeguard information about the app, and so they broadcasted that alert to everyone that has the technology on their phone, so they were aware of the substance that was causing overdoses. So it's also it's pretty nimble as well.
And are we doing anything with children in the schools and such for education on that as well, with the apps?
Yes, with the apps, we've shared, and we have lots of the printed posters that we can get to any interested provider. And I know that different school districts have been promoting or sharing that information where appropriate.
Oh, that's great. It's bad that we have to do it, but it's something we have to do. So I don't know how many times I've said that. My other question would be, I know Councillor Martin was asking about figures between city and the township. The other thing I would kind of ask for, and if you could send me that information about the app, that would be great. Sorry, before I forget about that. But the other thing I would like to know is not only overdose deaths or overdoses, what about brain injuries and how many people, because my understanding is these ODs are causing even more damage, and the numbers are higher for people that are being incapacitated long-term or lifelong. So I would like to see those numbers as well, because I believe something like this could prevent something like that. So my understanding was the numbers are quite high.
Yes. Thank you again for asking that question. There's different sort of mathematical modeling and studies. We have heard anecdotally from different care home providers around having younger and younger individuals presenting and needing more extensive and elaborate care from hypoxic brain injury. A lot of it's not always known because it doesn't always present right away or immediately after an overdose. Sometimes it takes a while for the brain injury to sort of present and in what kind of realm. The other piece that we know is that, and the reason why it's so important to catch these overdoses early, no matter where they happen, is that previously heroin overdoses would happen over a period of hours and they were often witnessed. And so there was more time to reverse and provide a medical intervention really quickly. However, or like and have effect. With fentanyl, the respiration rate drops so quickly that we have less time to respond and intervene in a way that will prevent death and hypoxic brain injury. And so that's why we don't want overdoses to be happening unwitnessed.
Okay, thank you. Thank you for those responses. I appreciate the information. Okay, does anybody else from council or staff or anybody have any questions? Outstanding. All right, well, thank you very much for coming tonight. We really appreciate it. And my understanding is you will get back to us on the answers to all those questions. So we appreciate that.
Yeah, no, thanks so much for the opportunity. And again, really appreciate the really thoughtful questions that you have, and certainly the concerns. And we do want to work together with you in the implementation of these services. As we've talked about, it really cuts across a whole broad section of individuals and concerns and interests. And we want to certainly try to address many of those concerns as possible. So again, thanks again for the opportunity. And we'll be happy to answer the questions to the best of our ability if you send them to us.
Great. Thank you very much. Thank you for taking the time.
Thanks. Bye.
Have a great evening.
Thank you.
Or afternoon, evening. I guess it's on that cusp right now, right? Okay, well, that was great conversation. So our next meetings, regular council meeting is March 8th, 2021. And the following one after that is March 22nd, 2021. Hard to believe we're already going into March. Okay, recreation update with Ms. Hilton.
There we go. Do you see the full screen? Yeah, great. And now you can hear me because of course I was talking and I was muted. So this is the update for recreation for February.
I see a split screen. Is that the idea?
You see the split screen?
Yeah, I see like page 1 and 2 together.
Now you do still?
It makes it hard to read the small print, that's all.
Yes. Let me unshare it and go back and see if I can fix this.
Sorry. It's only because I love your presentations.
Yes. I like them too.
Yes, you do. And you're very good at it.
Now, if I probably can't share this, I have to go back to here. Well, let's hope this works. Ooh, I'm feeling good about it now. Is that full screen?
That is. Thank you very much.
Okay, so update for recreation. Happy to say that we started back with some of our sport programs for children and youth, and we have a group of Active Start programs that have started already, but we do have another set that's starting at the end of March. So we have floor hockey for 2 to 3-year-olds, and that's with parent participation, and then floor hockey for 4 to 5-year-olds. And this is all with COVID safety protocols. So we're doing a lot of skill development. There's a lot of space in between the children, but they get to develop their skill and have fun and run around and make noise in our gymnasium, which I love to do. The same for soccer. Again, we have the earlier years, the 2 to 3-year-olds who have had very little participation in outings for this past year. And so they are quite happy to come out and learn how to interact with other people. And then our 4 and 5-year-olds as well. So if you're interested in the Active Start sports programs, you can phone 604-514-2940 to register or to go get more information. Or you can look onto our website at www.langleycity.ca. And then today was the start of open Cookie Monster registration, and that's at Douglas Recreation Center, and it's for children 3 to 5. You can see on the screen that we have separate programs, one for 3-year-olds and one for 4 and 5-year-olds. And I have to say that I did touch base with our receptionist at Douglas just before the meeting started. And she's been busy all day today with registrations. We have 1 spot left in the morning, a 3-year-old class. More spots in the afternoon, and the 4 and 5 morning classes are full with a fairly lengthy wait list. But I encourage anyone who's interested to phone 604-514-2865. You get to speak to the lovely Michelle, and she'll be able to answer all of your questions. And you know, things change for people, so we're registering now for next September. So you know, get your name on the wait list if that's the class you prefer, because there is always movement between now and the start of class. It's a great program. And again, we have our COVID safety protocols in place. So like the younger children, we do have our fundamental sports programs, and this is for children ages 6 to 12. And again, we have a basketball program and a soccer program running out of Tim's Community Center here. So if you're interested, you can phone 604-514-2940, and one of our lovely front desk staff would be happy to help you register, or you can go online as well at langleycity.ca. It's fun. These programs are all running, which is good to see. We also have our racket sports, and this is single play currently, though we keep getting asked if people can do doubles. Not quite yet, because the public health officer hasn't adjusted the guidelines yet, but we are hopeful that soon we'll be able to go back out in the park and do our double play. But we do have badminton and pickleball available, and you do need to register in advance. There are no drop-ins anymore. And I know pickleball, badminton in particular is usually full Saturdays. So you do need to register in advance for that. And again, you just dial 604-514-2940 to talk to one of the great staff here. We are looking at offering a teen pump class. We've had some people asking about it. And this is going to be running just in conjunction with our teen time at Tim's Community Center. So the rest of the public is not in the facility. It's limited to 6 people in the weight room. And it's going to start on March the 6th. So it's Saturdays from 6:30 to 7:30. It's an hour long for 4 weeks. And the youth do come out learning how to use all the different machinery within the weight room. And they'll have an individualized training plan, which is great for the youth. Again, you can find us online, langleycity.ca, or phone 604-514-2940. And we have seen, people excited to come out to our fitness classes. Most of them are held in the big gymnasium, so we have lots of distancing. They are low impact, low intensity, but you're still getting out and still getting active, which is healthy for the body and the mind. And you kind of get to see other people as well, so you can say hi from a distance. Again, it's pre-registration. We have safety protocols in place. And but it's great time, good fun, and if you're interested, you can phone 604-514-2940. Quite a wide array of programs being offered currently. And Taryn, our youth programmer, is busy coming up with activities for youth to do. So he has started the Tim's study space, and they're having physically distanced space within the games room here at Tim's Community Center, and also the youth lounge. So one's Wednesdays and one's Fridays. For more information, you can phone 604-514-2940, and there is no fee for this for the youth. Now, you will remember back, I hope, to last month when we promoted our Celebrating Arts and Culture, our virtual exhibition. We had a phenomenal display of art and culture and music and dance. And I just wanted to give some analytics for what happened with our event. I think it was quite successful. Tara Adele, our special event coordinator, put a lot of time into social media. She had posts on Instagram daily, sometimes several. We bumped up our Facebook. We did our city website. The whole event was on the website. And then we took out some digital ads with Langley Advance. So you can see some of the contact we've had with our community. So over 37,000 people our social media campaign reached. And this is in the first 2 weeks, which is where the big push was. Our Langley City website, we had over 1,000 views on the Langley Advance Times digital ad. You can see how many impressions we had, and that was how many times it's been presented to local consumers. The click-through number, click-through rate. As an industry, the average is 0.05. And for Black press in particular, they typically see 0.07%. And you can see we saw 0.13%. So I'm thinking we did pretty good with our first really big virtual event for arts and culture. We all prefer to do something in person, of course, but I think this shows this is a base for us now to compare to other events that we do online to see how we can compare. So Tara will have some stats for us for Family Day, because of course we did that virtually as well. But I think overall it was just a phenomenal event, and we're really proud of the work that we were doing in that regard. And that is my presentation, Madam Mayor.
Well, and you guys should all be proud. You did a fantastic job. So thank you. It was very well received and on so many positive comments. So thank you. Okay, I wasn't really looking at the screen. So I'm going to go with Councillor Albrecht and then Councillor Pahal, because I see hands up. And then Councillor Wallace, did you have your hand up as well? No. Okay. I see hands. So Councillor Albrecht, you go first.
Okay, thank you, Madam Mayor, and thank you, Kim. And I really just want to say, as one of the co-chairs of the Arts and Culture Committee, I really appreciate all the time, effort, and energy that the staff put into the Arts and Cultural virtual tour. I think it was phenomenal and very well received, as you say. So I just wanted to really express my appreciation there. Thank you.
Thank you.
Councillor Paul.
Thank you, Madam Mayor. Yeah, I was really excited to see those numbers for the virtual art. And it was also, while I know it wasn't promoted, it was not an event or a gathering or any such thing, it was kind of cool just to see the random interspersion of art throughout our downtown as well. So it was just kind of like a little pleasant surprise to see that. So that was really cool as well. So I hope that, you know, another event or like this happens, since I think we're going to be in a similar situation for the next little bit. And yeah, kudos to staff. And I don't know if this was initiative of the Arts and Culture Task Group, but if it was, kudos to you as well and the volunteers. So thank you.
Thank you.
Councillor Sturtevant.
Thank you, Madam Mayor. Thank you for previous comments as well. Thank you, Ms. Hilton, for your presentation. Always very watchable, exciting, talking about the good things that are happening in our community. Especially want to thank you for the virtual art. I've received a lot of good feedback on that. Very creative, really unusual, but in keeping with the times that we have. And I could go on and on about it, but I think I've actually used up all of my words today. So I'll just say thank you very much. Good job. Thank you, Madam Mayor.
The arts actually inspired me to put up my artwork behind me for council meetings. So thank you. I've gotten more back into photography since that. So thank you. And I hope other people have too. Councillor Wallace.
Sorry, I feel bad not talking about this, celebrating arts and culture, because I feel that it went really well, and I'm looking forward to it growing in the years to come. But what was really exciting, and I forget the name of the new gallery, Councillor James will probably know, but a beautiful new gallery has opened up, and I went in, and he right away wanted to be part of it. And a new pottery studio gallery is space also was part of the event as well. So I thought it was really, the businesses, I'm very thankful that they were a part of it. So thanks to Kim and Tara and the rest of the staff that were involved in it.
Great, thank you. I don't see anyone else. So thank you very much, Ms. Hilton. And Councillor Albrecht, I believe you have a report from Discover Langley City.
I do, Madam Mayor, and I'll try to keep it fairly brief and touch on the highlights. So it's challenging times, obviously, with the regional tourism Advocacy groups are holding regular meetings to keep the tour industry up to date on recovery efforts, resiliency plans, marketing plans, and statistics. These allow for community destination marketing organizations to be best prepared for handling marketing during COVID. This also allows the DLC to have tools and information needed for effective decision making and having a complete understanding of the challenges and opportunities available. So some of the meetings that they attended were Iconics 101 with Destination BC, Vancouver Coast and Mountains Regional Update, Destination BC, the Tourism Industry Association of BC, as well as the BC Hotel Association. So there's a community adaptation funding, and Destination BC has developed the DMO Community Adaptation Funding Program to assist the community DMOs and their community tourism associations in BC to adapt business models, programs, and services to help their local community tourism sector mitigate the impacts from COVID-19. So the community tourism organizations can access financial support to shift strategies, develop new experience, and drive tourism spending to their businesses and communities. And Destination BC will provide non-repayable funding for non-for-profit community tourism organizations to help them provide small and medium-sized enterprises in their communities with enhanced support and services related to the impacts of COVID. So Discover Langley City was successful in securing a $16,500 fund from this program. So they have a Canadian or Canada Summer Jobs Program. And the initiative is for a youth employment and skills strategy, which aims to provide flexible, holistic services to help all young Canadians develop skills and gain paid work experience to successfully transition into the labor market. Discover Langley City has applied for 2 positions for 16 weeks. And if successful, these individuals will be working as ambassadors to raise the profile of DLC and Langley City during the summer months. And the process is as follows. The DLC submits the application, gets signed off by our local MP, and then is submitted to the federal government body that determines eligibility. And we have been told that the results should be announced as early as April of 2021. Some marketing strategies. There's this Chew on This Tasty Tour. In 2021, a tactical plan for DLC providing support to new tourism product was identified as a priority. So Chew on This Tasty Tours has been operating in Fort Langley, and they were asked to consider downtown Langley as a second location. It was a perfect fit, resulting in a tour being developed. This is a carefully crafted culinary walking tour featuring exclusive and personal dining experiences, shopping, and highlights of the Langley City murals. The tour has been designed in a way to showcase interesting and exciting food destinations that really show off our city and encourages repeat visits. Tours are currently COVID friendly and being self-guided with a minimum of 2 people or a maximum of 2 people at a time. YouTube video advertising has been underway, and they're experimenting with different channels to promote Langley City assets. As food has been identified as the #1 tourism asset, DLC did an experiment to promote the food videos as an ad on YouTube. And by targeting the audience to Langley specifically to follow the public health orders in one 18-hour period, the video garnered 2,400 views and 7,200 impressions. Social media has been recognized from industry experts as being the top of their game for content and reliance on social media channels. While most communities have gone dark and are posting little or nothing at all, DLC consistently provides intriguing images and highlights of activities, shops, restaurants, parks, and contests to encourage residents to stay local, support local. This requires creative thinking, teamwork, and the support of the community, all working towards promoting Langley City, and the results have been outstanding. The Instagram and Facebook followers have more than doubled in the last 10 months, which is indicative that Despite these challenging times, Langley City continues to remain relevant and a place where people will want to visit when they are able to. So stay local, support local, go Langley. That's my report.
Councillor Bahal.
Thank you, Madam Mayor. To Councillor Albrecht through the mayor, I know this is probably obvious, but is this basically looking at encouraging like Langley City residents to discover Langley City this summer, or is it sort of the broader Langley, or does it matter, or does it change based on COVID protocols?
Yeah, I would have to say, and I can confirm with our DLC representative, but I'm feeling that we're obviously trying to keep it focused on local involvement, local support. But if it reaches out beyond our borders, there's nothing wrong with that. Let's keep that awareness up. Let's keep that interest in coming to our community when it's appropriate and when it's safe and those types of things. So we have a lot of cross-pollination between communities and boundaries and interests, and we don't want to lose any of that at all.
Okay, thank you.
Just don't come if you're from another health region, which is a provincial order right now. Did I see somebody else? No. Okay. You only get one question today, Councillor Albrecht. That's it. Sorry. Okay, moving on. Oh, we got a couple bylaws to deal with now. So bylaw 3144, zoning amendment and development permit number 06-20, third reading of a bylaw to rezone the property located at 20172 53A Avenue to accommodate a 5-story 18-unit apartment development at 20172 53A Avenue. Sorry, I'm used to saying 53A. A is an Alpha Avenue. That this bylaw cited at the zoning bylaw 1996, number 2100, amendment number 170, 2021, number 3144, be read a third time. Need a mover and a seconder. Councillor Storterboom, Councillor Bahal. Any discussion on that? Councillor Bahal.
Thank you, Madam Mayor. This is directed to staff, maybe Mr. Baumhoff. I realize this isn't about the zoning or the development permit per se, but I'm wondering if you could comment on where you landed with loading zones in the area to accommodate this.
Yes, thank you. We're basically, we'll need to accommodate a loading zone out on the street. So we haven't quite determined exactly where that will be, but it will be either on 53A or 201A, whichever is most convenient and least traffic disruption. So unfortunately, the site is just too small to have it on site.
Fair enough. Thank you very much, Mr. Baumhoff. Thank you, Madam Mayor.
Thank you, Councillor Paul. Councillor Sturgeon.
Thank you, Madam Mayor. And I just want to say that this is a really unique little building relative to, the fact that it's only 18 units. And it has taken an orphaned lot that would have been a really challenging fit, but the architects are bringing forward something that's especially attractive. I think it will really add to our community. I encourage all of my council colleagues to support this, and thank Mr. Johansson for bringing this to our attention. Thank you, Madam Mayor.
Okay, any further discussion on this? Seeing none, call the vote. All those in favor? Any opposed? And that carries. Bylaw 3151, 2021 to 2025 financial plan, a bylaw. Final reading of a bylaw to adopt the financial plan for 2021 to 2025. That the bylaw cited as financial plan 2021 to 2025 bylaw 2021 number 3151 be read a final time. Need a mover in this. Councillor Bahal, Councillor James. Any discussion? Any comments? Seeing none. Call the vote. All those in favor? Any opposed? Carries. Okay, property acquisition loan authorization bylaw 2021, number 3145, and alternate approval process. I believe Mr. Chung, you have a presentation for this.
Thank you, Madam Mayor. Can you see the presentation?
Yes.
Thank you. So this tonight will be a tag team between myself and Ms. Kelly Kenny. I will do the first part with respect to the property acquisition loan authorization bylaw, and then Ms. Kenny is going to be talking about the alternative approval process. So City Council adopted the Nexus of Community Plan back in 2018. The vision is largely, but not solely, predicated on the once-in-a-generation opportunity for transformational growth and redevelopment that comes with major transportation infrastructure changes like the SkyTrain expansion. And more importantly, to ensure that changes are aligned with our Nexus vision. The key ingredients of our vision include providing a variety of new mixed-use developments that offer a diversity of housing, community services, and business opportunities for residents, all in one place. We want to provide a thriving downtown core that provides meeting places for our residents, young and old. We want to offer daytime and evening activities, shops, restaurants, and even events that draw local and visitors into the city center. And we want walkable neighborhoods with an emphasis on green space and sustainable living, connected by efficient public transit. The investment now allows us to shape the type of redevelopment of properties along the rapid transit corridor. The city can drive redevelopment directly or partner with developers to ensure that the redevelopment achieves the city's goal as a transit-oriented nexus between Metro Vancouver and the Fraser Valley. Langley City Council has heard from our residents and recognized the current economic challenges from our residents, property and business owners due to the COVID-19 pandemic. In response to that, Langley City Council has now will be abandoning the original proposal to borrow $50 million for the loan authorization bylaw. Council is now looking at, subject to electoral approval, to borrow up to $7.5 million for strategic land acquisition. These property acquisitions will allow the city to start advancing our vision with important community building initiatives, including community amenities, transit-oriented development, and new investment. The loan will be repaid over a 15-year period through a property tax increase of 1.93% in the 2021 budget. The anticipated long-term benefits from this investment include transit-oriented development that fits the form and character of the community, new investor and businesses to support needs of the residents and visitors. And with that, I will now stop sharing and let Ms. Kelly talk about the alternative approval process. Thank you.
Okay, can you see that?
Yes.
Okay, so I do have a few slides that will outline the alternative approval process. So what we're asking for you to do tonight is to, or today, formally abandon the previous loan authorization bylaw 3112, and then give 3 readings to the new loan authorization bylaw 3145. Then we'll be asking you to approve using the alternative approval process to seek approval of bylaw 3145. So if all that goes past, then on tomorrow, I'll be submitting the loan authorization approval bylaw to the province for its review and approval by the Inspector of Municipalities. Once approval of the bylaw is received from the province, we will hold a council meeting where I'll bring a report to council to set a deadline for the alternative approval process, and then have council approve the AAP statutory notice and the elector response form. Then we will be advertising the alternative approval process, and of course those dates will need to be determined once we get the inspector approval. The public notice, we have to do two additions. And we will also be posting that information onto our website. Now, it's important to note that with an AAP, an elector who is in favor of the proposed loan authorization bylaw doesn't have to do anything. An elector who is opposed to the proposed loan authorization bylaw would sign an elector response form and submit it to the city by the deadline. So the 30-day elector response submission window begins the day the second ad runs in the newspaper. At that time, the elector response forms will be made available at the TIM's front counter and on the city's website. Eligible electors opposed to the loan authorization bylaw will then have 30 days to submit their signed form, either in person at TIM's reception counter, by mail, and also being sensitive to health concerns around the pandemic, we're also allowing them to be emailed. If an elector wishes to email their form, we still require that the elector hand sign that form, as electronic signatures cannot be accepted. The elector eligibility requirements are the same as for a local government election, and those eligibility requirements will be listed on the elector response form itself and will also be provided in the notice and on the city's webpage. After the 30-day deadline is passed, the results will be certified and then they'll be posted on the city's website. And a report will be presented to council on the results of the AAP with proposed next steps. If less than 10% of the electorate are opposed, the adoption of the bylaw may proceed. If 10% or more of the electorate are opposed, council must seek elector approval of the bylaw by assent voting, which is a referendum, or abandon the bylaw. So I'm happy to answer any questions if you have any.
Well, thank you both for the reasons and the process. I do have one question, Ms. Kelly, in regards to the signature. You stated that an electronic signature or hard copy signature is required. So if you sent that in electronically, I guess you could print it out, write it, take a picture, and then send it. Do you need an actual hard copy form as well, or does the email suffice?
Through to the mayor, no, we do not need the hard copy. We will accept the electronic version.
Great, thank you. Anyone else with questions? I don't see anyone. Okay, thank you. Okay, so that is bylaw 3112, loan authorization bylaw. I need a mover and a seconder on the motion of that the bylaw cited as the property acquisition and infrastructure upgrades loan authorization bylaw 2020 number 3112 be abandoned. So we are getting rid of that 50 million request. I need a mover and a seconder, please. Councillor Albrecht, Councillor Bahal. Any further discussion before I call the vote? All those in favor? Any opposed? Okay, so we've abandoned that bylaw. We're going on to bylaw 3145, which is the loan authorization bylaw, first, second, and third reading of a bylaw to authorize the borrowing up to 7.5 million for strategic land acquisitions. Motion is that the bylaw cited as the property acquisition loan authorization bylaw 2021, number 3145, be read a first, second, and third time. Need a mover and a seconder on that, please. Councillor Albrecht, Councillor Wallace, any discussion? Seeing none, call the vote. All those in favor? Any opposed to 7.5? Okay, on to submission of bylaw 3145 to Inspector of Municipalities. The motion is that City Council direct the corporate officer to submit property acquisition loan authorization bylaw 2021 number 3145 to the Ministry of Community Services for review and approval by the Inspector of Municipalities. Need a mover and a seconder, please. Councillor Stortaboom, Councillor James, any discussion? Send it to the province. All those in favor? Any opposed? That carries. And last is the alternate approval process, that the following approval of the property acquisition loan authorization bylaw 2021, number 3145, by the Inspector of Municipalities, approval of the electors be sought through the alternative approval process in relation to the loan authorization bylaw. Need a mover and a seconder. Councillor Stutterboom, Councillor Wallace. Any discussion on that? Seeing none, call the vote. All those in favor? Any opposed? And that carries. All right, next, on to the next section, administrative reports. We have a grant application to UBCM for Poverty Reduction Planning and Action Program. That council supports staff's grant application to UBCM Poverty Reduction Planning and Action Program, supporting the poverty reduction work and the grant management. I need a mover and a seconder. Councillor Albrecht, Councillor Wallace. Any discussion on that? Councillor Bahal.
Thank you, Madam Mayor. To Ms. Hilton, I just wanted to clarify, this will be funded jointly by the township and the city if township council also approves as well?
Yes, through Madam Mayor to Councillor Pahal. The township did approve a motion 2 weeks ago for a similar proposal, and the idea is that we would be bringing the funding to our poverty reduction task group, and it'd be a community-based initiative where we enhance our stats and lived experience, building on the work that we did in 2015. So it's quite exciting, and we can also use the information that we gain through this process for many of our updating Parks, Recreation, Culture master plans, for instance, transportation master plan. So it'll have some impact on many different avenues.
It's great to see that we'll be able to be used for our policies. Timing is perfect. I guess the other question I had was, this a phase 1 or phase 2 funding? I was a little bit confused. Would we be applying for more funding for more comprehensive plan, or what was that about?
Yeah, so this is, we can only apply for stream 1 because we do need to get those updated statistics and a strategy in place. Stream 2 does provide more funding than this one, but we don't qualify for that at this point. And we'll see if there's still some funding available. Once we complete our project, we could consider applying for stream 2 as well.
Wonderful. Thank you, Ms. Hilton. Thank you, Madam Mayor.
Okay, anyone else? Any further discussion on that? All right, call a vote. All those in favor? Any opposed? Carries. All right, and up next we have Housing Needs Report. We have a presentation from Patrick Ostrick from Modus Planning, Design and Engagement. Hello, sir. How are you?
Hi, everyone. It's a pleasure to be here back again in front of council and mayor. Thank you for having me. I can, do you want me to start, Carl? Or mayor?
Did you want to introduce him, Mr. Johansson?
Yes, sure, I can, Madam Mayor. Good afternoon, Mayor and Council. I'm pleased to introduce Patrick from Modus, give us an overview of the Housing Needs Report that Modus has completed for us. So in 2018, the province of BC, through the Local Government Act, requires local governments to do a Housing Needs Report every 5 years, and the first one needs to be done by 2022. So we have a Housing Needs Report here for presentation and review by council, and part of the legislative requirement is for council to receive the report. And as you know, as council knows, the directions out of this report are being incorporated into our draft OCP. So without further ado, I'll hand things over to Patrick.
Thank you, Carl. I'm just going to share my screen to go through the presentation. That's okay. All right. So again, I'm thrilled to be here today to present the final housing needs report that we've been working on over the last year or so. This was, of course, a project funded by UPCM through a grant application process. And so we were able to complete this report with that funding. Today, what I'd like to go over is just an introduction on housing needs reports, give you some key highlights from the profile of both housing and demographics in your city, provide some highlights of the community engagement process and some of the results that we received from housing stakeholders and other community stakeholders in the community. Present to you the future housing needs, so the projections that we completed, and then how we're integrating the results of the housing need report into the draft official community plan, and just a few notes of conclusion for next steps. So as Carl mentioned, recently, the Local Government Act was adapted to ensure that housing needs reports were being built into and considered as part of the development of an official community plan. Housing needs reports also have to be updated every 5 years. And so this was an essential component of the official community plan update. Housing needs reports collect data and base the report on statistical information around projected populations and current populations, information on household income, economic sectors, and then information on housing data as well. The report has to include for each type of housing unit, the number of housing units required to meet the current housing need, but then also the anticipated housing need for the next 5 years at least. And then there's also statements of need regarding specific demographics or groups within the community. So it's a mix of qualitative and quantitative data. In terms of data for this report, as you know, there isn't a one-stop shop for all the good housing data out there. We have to search all sorts of different databases. And in this particular case, we also used Environics Analytics at the bottom there of the list because they had some important information related to projections for household incomes that we were able to use in the model. And then also we held stakeholder interviews with a group of different stakeholders, the City of Surrey and Township of Langley, so neighboring municipalities, some housing stakeholders, community services, some developers, and also Fraser Health and the Queensland Polytechnic University, as well as the Chamber of Commerce. So a good range of different stakeholders there that were able to provide their input into this process. Something to note is that given we're in the middle of a pandemic of global proportions, that projections in this climate are very challenging. So it's important to understand that these projections and these data are essentially a point in time within a very dynamic environment. We've also noticed through COVID-19 that there's quite a few inequities that have surfaced in housing, specifically around those who might be who might live in inadequate housing for their needs. We know also that working from home is a new reality for many folks, and that might have an impact on the types of homes that we want to build, specifically around, ensuring that there's enough space for an office or those kinds of considerations. And then access to green space is also at a premium. So I think everyone sort of felt that around the time that lockdowns were instated, that need to sort of go out and access green space for mental and physical health just became very apparent. But without further ado, I'll jump into some of those key highlights in the Langley City profile. So of course, Langley City is projected to grow over the next several decades. We show two different data sources here. So there's the Metro Vancouver projection in the lighter blue, which has a bit more of an aggressive projection, growing a little bit faster than what the Environics trends data provided us in the darker blue. And so that's just to say that the data that's provided in this report and the results of the report are fairly conservative in nature. So it's at the lower end of the scale in terms of the numbers that I think we would aspire to reach in over the next few years. And that's because we use the Environics trends data, specifically because of the household income projections. Average and median household income is also projected to increase over the next several years. Though the community today is a little bit, that average and medium income in Langley City is slightly lower than the average in Metro Vancouver. It is slated to move upwards as the years pass over. In terms of housing types, we are also noticing some really interesting trends, essentially a big gap between the types of housing that exist in your community between single detached housing forms and apartments under 5 stories in height, essentially seeing what we call the missing middle being represented here by duplexes, semi-detached housing forms, or row houses, also known as townhomes. Just showing this this piece of information because I think it really represents strongly what we end up seeing in the results of the projections, that there's a bit of a mismatch between the supply and the demand of housing in the community, and focusing on some of those missing middle housing forms would really benefit the community to establish a bit more of a balanced housing market. The latest homelessness count, which is done by Metro Vancouver, was done in 2020, last year, in early March. So what we've seen is there was a fairly large increase in homelessness from 2014 to 2017. But then in between 2017 and 2020, it was fairly stable. However, that homelessness count was done just prior to some of the major impacts of the COVID-19 lockdowns. And so this may be a bit of an undercount given what we know about the economic downturn and sort of the impacts it's had on some of our residents. Looking at the makeup of subsidized units within Langley City and the township. So BC Housing provides data on this, but they lump Langley City and township together for 2019. We see that there's a fairly good range there of different types of housing units representing below market housing units. So with the majority or the most really focused in that rent assistance in the private market. That's where a lot of the stock of this type of housing is located, for a total around 2,484 units being represented here in terms of subsidized units across both communities. We do have data in the report that segments this between Langley City and Township, because in 2018, they did separate the two communities, but unfortunately, the latest data shows them as together. In terms of rental costs, what we've noticed is it was fairly stable over since the 1990s, increasing at a relatively slow pace, but then as of around 2015, the average rent increased quite dramatically. And that was pretty much the story for each one of these different types of unit sizes. So whether you were living in a bachelor or a 3+ bedroom type of unit, the rental costs certainly increased quite dramatically after 2015. And that's something that's being represented in the results of this report as well. And we'll get to in a bit more detail later on. In terms of housing ownership, we know that ownership costs have also increased over those years. However, one thing that we really like to highlight out of this graphic here is really the gap in cost between, say, a residential dwelling with a suite. So the second bar here at around $959,000, and a typical sort of townhouse or row house in Langley City, sitting at around $464,000 here. And so what that shows is a fairly significant gap, one that I think is in the model, in the projection, and in the results begins to show just how more accessible sort of a type of townhouse would be to most of the population here. And then one other big piece of data that needs to be shown in these housing needs reports is the percentage of households who are in core housing need or in extreme core housing need. And so core housing need is defined by 3 different factors. There's adequacy of housing, which essentially is determined whether the housing or the dwelling requires major repairs. There's affordability of a house. So ensuring that people aren't or households aren't paying over 30% of their income into their housing costs, and suitability of that dwelling. And so that's ensuring that there's an adequate amount of rooms for the size of the household. And so if any one of those three factors is apparent in a particular household, then they're said to be in core housing need. Extreme core housing need is when the affordability factor is not 30% of income, but when a household is paying over 50% of their household income towards housing costs. And so what we see in this graph here is that renter households are particularly represented in this core housing need segment. Around 44% of renter households are in core housing need. So those were a few highlights from the report in terms of demographics and housing costs in your community. I'll go over a bit of information now of the engagement results that we held with the stakeholders. So like I said earlier, we held interviews with a range of different stakeholders, and they had some really great input to provide us. First, we talked about challenges. And so what we heard was that people are remaining in supportive housing longer. And I think part of the reason that they're remaining in supportive housing a little longer is because it's also difficult to find affordable and quality housing for lower income households. Housing issues are also tied to social challenges. So things like mental health issues, also substance abuse. These are the types of challenges that housing is certainly faced with. We have few supports for youth, specifically age 12 to 25, specifically also for youth who are like aging out of foster care. And then we also identified, stakeholders also identified the challenge that we need more tenancy protection against the rise of redevelopment of rental properties. In terms of the successes within the community, we've heard that housing organizations are really well coordinated with each other. There's a lot of communication happening. The BC Building Code Adaptable Housing Standard has seen a really great success as well. So your planners have been asking for about 5% of new units in multifamily housing to be adaptable and accessible. And so that's been a great success over the years. Supportive and affordable housing is having a positive impact in the community, is what the stakeholders were telling us. And the City of Langley has a really fast development application processing time, which was applauded. And finally, Langley now has a rent bank. And so this is administered and provided by Sources Community Foundation. And essentially what it means is if somebody's car breaks down or any kind of unexpected expense comes through, a person can apply for a small loan at Sources and they'll ensure that essentially this person can repay that loan without necessarily losing their rent and losing their housing in case they can't make that because of that unexpected cost. Some of the gaps that the stakeholders identified in the housing market were secured affordable rental stock, co-op housing, family housing, pet-friendly housing, and I think that's specific to certain demographics, particularly seniors who might need that companionship. Single bed units for youth, especially those who are aging out of that foster care system. Supportive housing, and short-term housing, and that's particularly specific to women fleeing violence, for instance. And then also mixed income communities. So this idea that the current sort of affordable housing stock is sort of perhaps clustered in one region or one area. Some of the underserved populations that were noted by the stakeholders were seniors, and particularly older single women, Indigenous people and families, who there is a fairly large Indigenous urban population in Langley City, women with large families, people who've never been homeless. So some of the stakeholders were saying that, typically they would see some fairly familiar faces over the years, but that in recent times they were starting to see newer faces that they hadn't come across before. Youth who've aged out of foster care, people with precarious legal status. This could be immigrant status or refugees, people with mental health issues and or are active in substance abuse. So some of the stakeholder needs that they identified over the course of our interviews were affordable land. So obviously access to affordable land is a big challenge in the city and across the region. And any access to that land provides them with much more ability to build the type of units that are needed in the community. They also identified the need for more public-private and public not-for-profit partnerships. So identifying that need of partnering with developers or with other communities, governments, and not-for-profit groups. Supportive zoning, so ensuring that there's flexibility within the zoning so that new housing can come online fairly quickly. And just generally more resources. There was a sense that some of these organizations, they get a lot of money from donations, and in the middle of a pandemic, there's a bit of a threat there that I think was being voiced. So diving into some of the projections, what we did for the current housing need is we looked at, in 2019, the income segments in your community and compared that to what would be affordable to them in terms of housing type. So everything from a single detached home to a strata or attached, so townhouse type form, all the way to a rental type of unit that was built in the 60s and 70s. And so really what this shows is which income segments can afford a certain type of home. And something to highlight here is that as of 2019, a household would need an income of around $156,000 to afford a single detached home. And that represents about 11% of the population in Langley City today. In terms of a townhouse, right now, the requirements to afford a townhome in Langley City for a household income is around $79,000 there. And that represents approximately 41% of residents in your community. So just showing that big gap between what is affordable these days in your community. As for 2024, so looking out into the future, when household incomes have grown a little bit and housing costs as well, we look at the same graph, and really what we see is just a little bit of a difference in the percentages here. Essentially, the household income required for a single detached home would rise up to around $182,000, and that starts to represent only 10%. So we see a small decrease there in the percentage of households or residents who could afford that threshold. And then similarly for the household income for townhomes rises up to $92,000, but still represents around 41% of the residents in your community by 2024. Next, after having calculated that, we looked at demand by housing type. And so this was done by assuming that a household would demand the highest form of housing that they could afford. So if a household can afford a townhouse, then they would be in demand for that type of housing form. And what we see here is that, again, a large number of households can afford that semi-detached and row house form in that yellow line, while the single detached housing forms have started to decrease over the years fairly significantly since 2011. And so really looking at, again, that gap. And when we start looking at the supply of these types of homes in Langley City today, what we see is, again, a small mismatch there, or a significant mismatch, I should say, between that semi-detached form where there's a significant demand for that type of housing form and yet a relatively small supply of it. And then also I should note here, in terms of subsidized housing, what's happening here is the supply is capped by the type of housing or the amount of housing that government can provide in terms of subsidized housing. And so the number here of folks who may want subsidized housing are finding housing likely within that rental stock, that older rental stock. Similarly, for semi-detached owner or semi-detached homes, what's happening is many of the folks who could afford a semi-detached home are likely finding that supply within a condo, which has a significant supply of condos within the community. Next, we had to also calculate the same sort of projection, but for unit size. And so only the census carries this type of data between 1 bedroom all the way to 4+ bedrooms. And so comparing that demand versus the supply that you had in 2016, we noticed an oversupply of around 2 to 3 bedroom units, and an undersupply of bachelors and 1 bedroom units, and a slight oversupply of 4+ bedroom units in the market in 2016. Now, comparing that to the 2024 demand, what we end up having is a change in the number of households, which represents the net new units that are required to be built by 2024. Now, of course, what this does, it assumes that in 2016, these households were finding housing in the existing supply of the market. So again, it's a fairly conservative number that we're providing here. That with the Environics projections that showed a bit of a slower pace of growth than what the Metro Vancouver numbers would show. So we would consider these numbers to be sort of at that lower end of the spectrum. And of course, given that we're in a very dynamic environment, all sorts of other sort of factors can play into the demand for housing, like for instance, a new SkyTrain line, economic development, affordability challenges in other communities, nearby communities. And so I think the note here is to just say that these numbers are on the fairly lowest range of need required to be met by 2024. Other key findings in the report are that single detached homes are not attainable for a majority of Langley City resident income groups. The need for a greater variety of ownership housing with an emphasis on townhouses. There's affordable rental options are needed, especially within that primary rental market, so purpose-built rental. More aging in place options and seniors housing for an aging population. And again, more below market and non-market supportive and partnership-based housing options, of course, is always a need. And so taking these findings and integrating them into the OCP, I just wanted to highlight how we've done that and how it's shown in the draft OCP. So as you know, this is the draft land use plan. We have designated some areas around the SkyTrain stations for transit-oriented core and transit-oriented residential that represent the highest densities and the tallest buildings and the greatest mix of uses. This is really a location where a lot of that need for 1 or bachelor type units, 1 bedroom or bachelor type units will be located through this land use plan and will be accommodated. There's also 2 large corridors that are slated for townhomes and plex type housing along future frequent bus routes along 200th and 208. So this is again, trying to get at that need for townhomes in the community and that demand. Gentle infill housing forms like secondary accessory units north of Grade Crescent. So again, trying to get more of those mortgage helpers and opportunities for bringing in more rental type units into the housing stock. And so paired with the land use plan are also some key housing policies in the draft OCP. So essentially encouraging a diverse and balanced housing mix with mixed tenure developments, ensuring there's both ownership and rental options, and also encouraging the use of or the development of cooperative housing as a unique housing form that doesn't exist in the community today. But also building more accessible units and units for aging in place. So we've bumped up that 5% threshold for accessible units to around 20% of of bottom floor units in multifamily development. Also incentives for purpose-built rental and one-to-one rental unit replacement. So ensuring that we're not losing rental units as redevelopment occurs. This is also paired with some with a new tenant relocation policy, as was asked by the stakeholders, and more 1-bedroom and 3+ bedroom units. And so again, just really trying to encourage those types of units in any new development that occurs. So in terms of the conclusion to this report, I just want to note that we're now in the phase 4 of this process of updating the official community plan. And we are integrating the feedback from our past engagement at both the virtual open houses and the online survey into that draft report here now as we enter March. And any kind of helpful insights on the housing market is also being integrated in there. We have to post the housing needs report online for stakeholder organizations and other groups to understand the housing market and to see this data. In early March, we'll also be refining the draft OCP, as I said, providing a final OCP that we would be presenting to council at the end of March or early April, and guide that OCP through a bylaw adoption process, including the formal referrals and a public hearing. So with that said, that's the presentation I have for you today. Thank you very much.
Well, thank you for such a great presentation. There's lots of information there. So we've been waiting a while to get that done. We knew we had to get it done because the government had said we needed to. So it's nice to see. Councillor Sturdivant.
Thank you, Madam Mayor, and thank you, Patrick, for a report that is just chock full of great information. I think that your PowerPoint presentation or whatever software you use is excellent. They fit together very well, and you speak very well. Very powerful presentation, lots of good information. Is there any consideration for the current market? The real estate market is just unbelievable right now. It's so excited. I don't know that you could project where we're going, but considering, you know, how detailed your report is and how I have every reason to believe that your projections are right on target, I can't help but be curious if this is something that should be taken into consideration or at least be commented on.
Yeah, and through Madam Mayor to Councillor Sturdivant, what we're seeing in the market right now is likely, you know, a little stronger than what we had expected when we even just began the start of this process. And of course, when we were writing this report, we were using, you know, 2019 data. And so it's very likely that the housing market is very strong right now and is likely going to overtake some of these numbers that we have in the report before 2024. You might meet and exceed those targets, and I wouldn't really think of them as targets. I would maybe think of them as just the basic or the lowest line to achieve that need in the community. And so exceeding those targets, I would say, is actually a good thing, because it could also help with all sorts of other factors, like providing residents with more choice in the housing options that they have, and potentially also lowering some housing costs. So when more rental units come online, for instance, then vacancies tend to drop, or vacancies tend to go up a little bit, which essentially gives people more choice and allows for those rental costs to stay stable or even decrease in some cases. So really focusing on that and ensuring that, you know, those numbers that we provided there are exceeded would be great.
Thank you very much. Again, an excellent report. You've done a wonderful job of putting this together, giving us a tremendous tool to work from. Looking back at our immediate past and moving forward into our bright future. Thank you, Patrick. Thank you, Madam Mayor.
Thank you, Councillor Albrecht.
Thank you, Madam Mayor, and thank you, Patrick. I'm so pleased that this housing needs report aligns perfectly with our vision for our OCP and our Nickel River District plans. And just recently, Metro Vancouver, the regional planning committee, set out a policy paper which also aligns quite nicely with what we're looking at here in terms of what housing, transportation, as well as building complete communities. So we all seem to be in harmony. And it's going to be nice to see how all this all comes together and creates the kind of community that we all want to see in the future. So thank you for that. And Madam Mayor, I'll move receipt of this report. Thank you.
Thank you. Councillor Wallace.
Thank you. Thank you for the extensive report. I still have some concerns, and one of them is the aging out of foster care, and the, seeing people that are homeless that have not been homeless before, and then just the downward spiral of that happening. So I'm a little bit worried, and Councillor Albrecht just talked about building complete communities. In building complete communities, it's all demographics, and it's serving all demographics in a city. So I think we have to be creative when it comes to when we're densifying, and I'd like to look at what would a co-op look like in a densification model, whether it be in a high rise or in, I don't know if somebody could talk to that, because I just feel that just the affordability for finding a place to live for so many with that community connection is so vital. So I don't know if Mr. Johansson could speak to that, or yourself. What would that look like?
Yeah, I can speak a little bit to, or through Madam Mayor, to Councillor Wallace. I can speak a little bit to the co-op model. I know that many developers are hesitant to go into the co-op form of housing, and partly because of the expense and the time that it requires to get built. And it often requires a group of very dedicated individuals and with some fairly deep pockets to get it built. So it is something that developers tend to shy away from. In terms of the housing policy that we have in the OCP, what I can say is that we have identified some fairly innovative ways to ensure that affordable rental stock is incentivized. So through perhaps certain types of parking reductions or density bonusing, for example. So we're looking at those types of options in the OCP. I think we also noted in the housing needs report at the end that there are some federal programs right now that do speak to co-op housing and will help with the funding of co-op housing. So it really is about identifying, I think, a group of interested individuals who would like to go down that road, and then partnering or helping them with the resources to essentially get it built. But I think the affordability of the land and sort of finding that group of individuals who want to live in a co-op together is really the challenge in getting it built without direct sort of developer involvement.
Yeah, thanks, Patrick. And Madam Mayor, if I may, I can just mention that, with our new draft OCP, we definitely have language in there about encouraging partnerships with senior governments, not-for-profits, and developers. And we're seeing some of that bear fruit, with the penny farthing project on 56. They're going to be obtaining funding from CMHC to develop below market rental housing. Our OCP is pretty specific, our draft OCP, in terms of identifying, encouraging co-ops, mixed tenure developments. And I think that with SkyTrain and the growth of the community over the next 10, 20, 30 years, we're also planning for density increases in key areas of the city, close to the downtown, close to SkyTrain. And when land is an impediment in terms of affordable land, adding a little bit of density to the mix is very helpful to help bring those types of projects forward and help them be more affordable. And of course, we're going to make sure that density is, results in good neighbor developments, but that's where the OCP has to sort of put all those policies together into one package.
Great, thank you. Yeah, I'd also like to see childcare almost tied into this, of what housing needs with the condos and the apartments and the rentals. I think with COVID, we're seeing more people work at home, but once COVID is over, I know our numbers for childcare are already through the roof, and I wonder if I know we keep hearing people are going to stay at home, but I wonder if that's going to be the opposite, that people are going to be so tired of being at home, and people that need to make money that never worked before are going to have to go out and get a job to keep up with the bills and everything because of COVID. So I wonder, I really worry about our childcare numbers. Councillor Stortaboom.
Thank you, Madam Mayor. I just wanted to comment on Councillor Walsh's interest in cooperative housing. To the best of my knowledge, there is one cooperative in the Langleys. It's off of 96th Avenue in Walnut Grove. It's called the Windsong. And it's certainly something that you might like to investigate. People there are very friendly, and they are all of the similar ideology, and they can explain to you how all of the money works around that type of business model. And just with regard to your comments, Madam Mayor, there are some child care services being provided in the city of Langley, as you know, at Highland Village Mall and the old Region. But I think the model that you're thinking of might be like at the Elements, which is behind the Best Buy there up by Walmart. So right across the street there, they got a lovely storefront facility, but that is an entrepreneurial kind of a situation there. It's not necessarily a part of the strata, except that I think the strata owns that unit and they probably rent it out. So anyway, that's just me beacon off. Sorry about that. Thank you very much.
Well, it's great info. And I did talk to several developers that are looking to build in Langley, and they said if they had the right community space, then it can be used for childcare, so amenity rooms. So that's a good thing. But like I said, it's greatly needed. So any other questions or comments? Okay, so Councillor Albrecht, yes, Carl Johansson, Mr. Johansson, did you have a?
Yes, thank you, Madam Mayor. Just very briefly, as part of our zoning bylaw update to implement the new OCP, we'll be looking to permit childcare uses in a lot of our zones. To make that a lot easier, you go for a rezoning, or if you have it in your zone, we want to make that pretty straightforward.
No, that's fantastic. Thank you. Again, healthy and safe community, right? That's what we're building. So, okay, so Councillor Albrecht moved that. I need a seconder on that, please. Councillor Stortaboom, any other discussion on this? Seeing none, I'll call the vote. All those in favor to receive this? Any opposed? And that is good. Thank you. It was great discussion on that.
Thanks, Patrick.
Thank you, Ms. Rostrick and Mr. Johansson. That was fantastic. I'm sure we'll see you soon, Patrick. Take care. Thank you. Okay, moving on to community grants. So rather than reading out the list of all the recipients and amounts, is there anyone opposed to taking the list as read when I read out the motion? Seeing no objections, motion is that City Council endorse the recommendation of the Community Grant Committee to award community grants totaling $114,076.29 to the organizations as listed in the staff report. Need a mover, Councillor Wallace, Councillor Stortaboom. Any discussion on that? Councillor Stortaboom, go ahead.
Thank you, Madam Mayor. Yeah, I think it's great that we can provide community grants, especially during the challenging times that we're experiencing and financial stress around the casino. I can't help but be curious about how these grants are announced, because as you know, these are all great organizations and they're all good people, and they all kind of want to know, when am I getting my money? When can I do what I want? And unfortunately, it seems that some find out sooner than others, and I'm really uncomfortable with releasing information until we get to this stage, and then they can be advised. So is there some kind of uniformity in how we should be doing this? Because I get the impression that some people are finding out before others, and it's making other people anxious, and I don't really want to say anything until we get to a final. So any enlightenment you have around that and guidance would be appreciated. Thank you.
I believe Mr. Light would be the one to answer. He's up there and ready. I know he is.
So we would now, after council's approved the grants, then we can send out emails to the grant recipients. So at this point, we don't say anything to anybody because it hasn't been approved.
Okay, so I guess some people just kind of, I don't know, get an inside look or something. It's just, it makes it awkward. Let's just watch that in the future. Then everybody's the same. Thank you.
Okay, did I have? Okay, so that was the discussion. Yes, Councillor Wallace.
Oh, no, I just moved it. Sorry.
Okay, seconder on that. I think it was Councillor Storterboom, so it's all good. Okay, all those in favor? Any opposed? And that's wonderful. Yes, even without the casino open, we still give grants to the provincial government, so fantastic. Okay, so new and unfinished business. Notice motions and notice. Got nothing. Correspondence, we don't have anything. New business, a motion to hold a closed meeting. Councillor Storterboom, Councillor Martin.
Well, I did have a question.
In regards to
correspondence.
Okay.
Thank you. I know the answer to this, I think, but just through you to Ms. Kenny, I can assume, as we haven't received in our weekly correspondence, we've never received a reply from our MP in regards to her comments.
Through the chair to Councillor Martin, no, we haven't received a written response yet.
And that's been about a month ago we wrote the letter.
I'd have to check, but
I think it was 2 meetings ago, so that's got to be about a month. Thank you.
Okay. Councillor Storterboom.
Oh no, I was just smiling and nodding.
Okay. All right, so new business, motion to hold a closed meeting, that the council meeting immediately following this meeting be closed to the public as the subject matter being considered relates to items which comply with the following closed meeting criteria specified in section 90 of the community charter. 1, a part of a council meeting may be closed to the public if the subject matter being considered relates to or is one or more of the following. C, labor relations and other employee relations. J, information that is prohibited or information that if it were presented in a document would be prohibited from disclosure under section 21 of the Freedom of Information and Protection of Privacy Act. K, negotiations and related discussions respecting the proposed provision of a municipal service that are at their preliminary stages and that in the view of the council could reasonably be expected to harm the interest of the municipality if they were held in public. L, discussions with municipal officers and employees respecting municipal objectives, measures, and progress reports for the purposes of preparing an annual report under section 98, annual municipal report. I need to move her in a seconder, please. Councillor Storterboom, Councillor James, any discussion? Call the vote. All those in favor? Wonderful. All right, so we are going to adjourn this meeting. So I'd like to thank everybody and remember, keep your distance, wash your hands, wear your masks, and be kind, and don't forget it is Pink Shirt Day on Wednesday. So I'm going to call that the meeting adjourned. I need a mover and a seconder, please. Councillor Storterboom, Councillor Pahal, all those in favor? Wonderful. All right, so we are going into another meeting. So thank you for everyone for coming out. And I believe the recording is going to be turned off.